68. And then we'll see 68 on Sunday. Saturday, of course, a very blustery day. Look for temperatures around 70 Monday, Tuesday, Wednesday. Not too bad. It is my pleasure to again reintroduce Dr. Stephanie Moline from Care Northwest, really our knowledgeable rock star when it comes to breast cancer. She is a breast surgeon, and we thank you for being in here. Off the phone, someone didn't have access to a computer but called and said, what about soy? This seems to be something that we're hearing about. It was bad, it's okay. What is the soy conversation?
That conversation is basic chemistry. The soy is a phytoestrogen or a plant-based estrogen, and in normal dietary soy that the average person could have, soy milk, soy food products, it's not concentrated, and the estrogenic effect on the breast tissue is probably pretty minimal. And there are large cultures that have soy as their main dietary source of protein and still don't have an increased risk of breast cancer.
All right, so
however, in concentrated forms, such as soy powders, concentrated drinks, you could potentially, and more theory than fact, but theoretically have a higher incidence with estrogenic type activity.
So we're going with moderation on all things.
That's true for so many things.
Yeah, it really is. All right, now we have another really sort of a question. Katie Elliott writes on, again, Facebook, it seems like more and more women are getting breast cancer in their 30s. Have statistics been rising in the age group, or has technology and awareness improved the earlier detection?
Well, 30-year-olds wouldn't be screened in terms of mammography, but they might be more aware, and that's what this conversation's about, to be aware of changes. It's actually might be that you know more and more women in their 30s to be affected. You may not have been aware in your 20s because you didn't know those people.
Right.
So it is actually not an increasing incidence.
Okay.
It is probably being detected maybe a little bit earlier by awareness and getting checked when things do seem different.
Okay, and having these conversations with your doctor, with your family, with your mother and grandmother when possible, and knowing both sides, both male and female history when it comes to health.
Yeah, important to have that open conversation and not be secret breast, don't talk about it, shh.
Right. Well, cancer, no one likes to talk about it, but it's something we need to talk about. We all know somebody who's been affected by cancer, some family that's been affected by cancer, and that's what we're going to do this month, is try to bring that about through, again, breast cancer.